Now, one of you, Douglas Ford, Douglas was named one of Forbes 30 under 30 in healthcare for co-founding Chromie Health. Congratulations, Douglas.
Hey everyone, I'm Douglas Ford, co-founder and CEO of Chromie Health. I wanted to give you a quick look at Chromie Dispatch and how we're helping hospitals respond to one of the biggest operational problems in healthcare, last-minute nurse callouts. A new and growing problem that not many people are aware of. Today, when a nurse calls out, whether they're sick, burnt out, or have a family emergency, staffing agencies often rely on manual texting, phone calls, expensive agency staffing, or outdated scheduling systems that just weren't built for real-time workforce operations. Healthcare moves in real time. However, many staffing systems today just don't. And that's where Chromie Dispatch comes in. When a nurse calls out, Chromie calls in. So this is the Chromie Dispatch dashboard. The platform gives staffing teams and nurse leaders a centralized operational view of open shifts, staffing activity, nurse availability, and dispatch workflows across all units. Right here, you can see active staffing gaps, current dispatch activity, shift status, response tracking, and fulfillment progress in real time. One of the biggest goals with Chromie was reducing chaos during a staffing shortage. Instead of manually texting dozens of nurses during a call-out event and hoping for the first to respond to be the best, the platform analyzes and automates that workflow. Let's take a look at a staffing event. Here we have an open shift. We can see the unit, role requirements, shift timing, staffing urgency, and fulfillment status. Traditionally, this process might require a charge nurse or staffing coordinator to manually contact nurses one by one, and that could take upwards of 5 hours. With Chromie Dispatch, the platform intelligently identifies qualified staff and initiates outreach automatically. You can see the dispatch workflow here. The system tracks outreach, response confirmation, and fulfillment activity in real time. This dramatically reduces administrative burden while helping hospitals fill shifts faster and more efficiently than ever before. In many hospitals today, staffing coordinators are still relying on fragmented workflows, texts, calls, spreadsheets, sticky notes, and agency escalation, which could cost tens of thousands of dollars for just one shift. Chromie centralizes that all into a single operational platform. We also designed the experience around nurses. Our team consists of many former nurses that really gave incredible input into designing the platform. Nurses can quickly review available shifts, respond, and confirm availability, all without unnecessary friction. One of the biggest pieces of feedback we hear from hospitals is that current staffing processes create burnout, not only for nurse leadership, but nurses themselves. Our goal is to reduce the operational stress on both sides, so healthcare clinicians can get back to focusing on patient care. Beyond dispatching, the platform also gives leadership visibility into staffing patterns, response behavior, fulfillment trends, and operational bottlenecks. Over time, this creates a much richer intelligence layer around workforce management. Dispatch is our first major workflow layer, but the broader vision is for Chromie to be building an AI-native workforce platform for healthcare operations. We believe that workforce coordination in healthcare is still massively underserved by modern software infrastructure. And here at Chromie, staffing is just the beginning. Since launch, we've helped fill tens of thousands of shifts and are working with hospitals actively looking for faster, more intelligent workforce operations. We're incredibly excited about where this is going, and it's just the beginning. Thanks for taking a look at Chromie Dispatch.